My name is Dr. Melissa Androsov, and I am a functional medicine practitioner passionate about helping couples optimize their fertility naturally. I wanted to touch a little bit on the basics of a condition called PCOS. So, PCOS, or polycystic ovarian syndrome, is a complex hormonal and metabolic disorder that affects women of reproductive age. It's one of the most common endocrine disorders, and according to the World Health Organization, PCOS affects 8 to 13% of women of reproductive age. But something to note is that around 70% of PCOS cases actually go completely undiagnosed. So, how does PCOS happen? What is its etiology? Well, let's first understand what's going on during a normal menstrual cycle. So, in normal cycling ovaries, every month a cohort of follicles, which contain eggs, undergo a maturation process, and one of these follicles becomes a dominant follicle and releases its egg, which is termed ovulation. And now this egg is available for fertilization to occur by a sperm, if a sperm so happens to come along. However, in PCOS, the ovaries fail to regularly release mature eggs. So instead, the ovaries develop numerous follicles, which really we can think of follicles as these fluid-filled sacs that surround and nourish the eggs, right? But these follicles in PCOS patients are unable to fully get to that point of maturation to release an egg, resulting in irregular or even absent ovulation. This is what gives PCOS its name of polycystic, referring to the multiple cysts or follicles that develop in the ovaries. Now, I do want to make a quick note here on diagnosing PCOS. So, to actually diagnose PCOS, we use something called the Rotterdam criteria, which states that a woman must have two of the following three criteria met. One, she must have a legal ovulation or an ovulation. So, a legal ovulation meaning irregular ovulation, and then an ovulation meaning that she doesn't ovulate at all. Number two, she can have high androgens, which can either be confirmed from lab findings of high testosterone or DHEA, or by the presence of things like excessive acne, right, often along the chin line, androgen alopecia, which is hair loss, or hirsutism, which is when a woman grows hair where she really doesn't want to grow hair. So this might be hair growth along the face, right, the chin area, the chest, the abdomen. And the reason I bring this up is because not all women who have this PCOS picture actually have polycystic ovaries. So they may have the high androgens and the irregular cycles and still have PCOS. So just something to kind of keep in mind. So getting back to the etiology a little bit here, at the core of this follicle maturation issue lies a condition called insulin resistance. Now, many of you may already be aware, but insulin is a hormone that helps regulate blood sugar levels by allowing cells to basically take in and use glucose for energy. But when cells become resistant to insulin, the body overcompensates by producing more insulin, leading to excessive levels. The high levels of insulin can promote high levels of androgens, which can disrupt the normal ovulation process, preventing those follicles from fully maturing and releasing a mature egg during ovulation. And so as a result, the immature follicles start to accumulate in the ovaries, forming the characteristic cysts that we see in PCOS. And it's this anovulation, right? The lack of ovulation or the irregular ovulation, where maybe she goes 3, 6, or even more months without ovulating. That is a major reason why PCOS is a leading cause of infertility in women. It also contributes to the hormonal imbalances and irregular menstrual cycles that are really hallmarks of this condition. And the high levels of insulin and androgens in PCOS also contribute to other common symptoms, like we mentioned before, of weight gain or acne, excessive hair growth, and even an increased risk of developing metabolic disorders like type 2 diabetes and cardiovascular disease. And these risks can remain even into postmenopausal years if no interventions are ever carried out. So, from a functional medicine perspective, various factors can contribute to the development of PCOS. This could be genetics, chronic inflammation, environmental toxins, gut dysbiosis, nutrient deficiencies, and really just an overall unhealthy lifestyle. Conventional treatment often focuses on managing symptoms with medications like birth control pills, anti-androgens, and insulin sensitizing drugs like metformin, right? And while these might provide relief, they're not addressing the real underlying root cause of what's going on. So, from a functional medicine perspective, addressing insulin resistance, reducing inflammation, balancing hormones, and really just supporting overall metabolic health can help to restore normal ovulatory function and even improve fertility outcomes in women with PCOS. So, by understanding the root causes and the mechanisms behind PCOS, a personalized functional medicine approach can provide a comprehensive solution for managing this complex condition and its symptoms. Thank you so much for watching, and don't forget to watch my next video, which highlights a couple of natural treatment strategies that can help manage PCOS.